But the climate change czar, former Liberal Treasurer Matt Keane, he's gotten really cranky, James Ashby, about taxpayer handouts, he calls them, to keep coal stations like Eraring running. Well, the only reason we need to keep Eraring running is otherwise there'd be no lights on in Sydney. I mean, this is crazy stuff.
Well, if you think back, Eraring was sold off for $50 million by the New South Wales government back in about 2013, I think it was. And now they're looking to pay in subsidies as a government $225 million a year. They said they'd wash their hands of it back then. Well, now, because they can't keep the lights on with these renewable projects, they're having to chip in, and we're all having to pay for it, of course, through our higher electricity bills. You know, it's one thing to go down this path of renewables. I've got them on my rooftop. They're good for only so much. When I get a few extra guests in, guess what? That solar hot water system needs the button flicked on at the wall so that it uses electricity as well to keep the hot water up to the guests in the house. And same with the power. We've got to have redundancy measures, because when the wind isn't blowing, the sun isn't shining, of course we've got to peak that electricity back into the grid, and that means having these peaking gas stations. And so it should be part of that scope, because if we're going to have capacity moving forward as a country, we definitely need gas in the mix.
Let's go to New South Wales and use your health policy brain, Terry Barnes. The New South Wales government is going to double the amount that patients with private health cover have to pay to use a public hospital room. Now, that'll be double dipping. It's a massive increase. How's this going to be helpful? Surely this will make people who have got private health insurance basically give it up so they get the room for free rather than pay double as well as their private health insurance.
Yes, well, that's right. And I think the health insurance industry is right to be concerned about this. And more to the point, I think health insurance premium payers have every right to be absolutely angry about it. New South Wales is the only state where this happens. And don't forget, there is no GST on your private health insurance premiums because it's seen as a health product. Now, when it comes to New South Wales, and it comes to other states as well, I mean, there's another side to this, and that is the fact that they have people on their staff, so usually with titles like patient liaison officer. So you go rock up to emergency, say, and they ask you if you've got private health insurance, and you say yes. They actually prey on you to actually use it. So they want that health fund money in the system because it saves them many thousands of public patient money. So this is the cost of a private room is something that is worthwhile to the states. Why New South Wales is trying to tax that, I just do not know. I just think it is bad policy. If I was the federal health minister, Peter, and I was once involved in dishing out public hospital funding to the states, I would actually dock New South Wales $1 for every dollar they take from that tax.